explain the disease. Professor Dai explained superficial mycosis and introduced some fungi, some important fungi, like as Aspergillus, Mucor, Cladosporium, some fungi that are important for medical mycology. I should explain cutaneous, subcutaneous, and systemic mycosis. Therefore, we start and begin to explain dermatomycosis or dermatophytosis or cutaneous mycosis. Cutaneous mycosis means cutaneous mycosis means each mycotic infection. Every mycotic infection. We have two terms: dermatomycosis, dermatophytosis. What is the meaning of dermatomycosis? All fungi that can involve skin. Involve skin. Dermatophytosis means a skin infection by dermatophyte, a group of fungi. A group of fungi. We must explain in this class dermatophytosis. In next class, we explain cutaneous and systemic mycosis and some infection that involve a skin layer and lead to a skin disease. But in this class now, we only explain dermatophytosis. Dermatophytosis means a skin infection by dermatophyte. Dermatophyte is a group of fungi that lead to cutaneous infection. Dermatophytosis. It has some synonym term like as ringworm or tina. I don't know in Arabic what is name. You know in your country, in your language. Tina, what is tina? What is dermatophytosis? What is ringworm? The name is we have an infection that involve a skin layer. Another name, old name is ringworm. Old name is tina. What we use ringworm for this infection? Yeah, ring, yes, a worm. It is an old name because at first thought that this infection produced by a worm that lie in a skin. Dermatophyte is a group of fungi. They are keratinophilic. Keratinophilic. You have keratin layer, keratin tissue in surface of a skin. Yes, and this fungi like this material for growth, for sporulation, for spirit and reproduction. These fungi are mycelial fungi, not yeast form in shape. Dermatophyte are a group of fungi that like keratin and are mycelial fungi. Dermatophyte has three genus. Microsporum, the name of genus of dermatophyte. Microsporum, Trichophyton, Epidermophyton. We have three genus. They have three sources. Anthropophilic source. What mean? Yes, this source means human source. Somebody, some person have this fungi in a skin and transfer to another person. These fungi are anthropophilic. And some of dermatophyte are zoophilic. Animal. The source in skin of animal, like as cat, dog, cow, sheep, bird, horse, and some dermatophyte transfer from this animal to human. These fungi lead to acute reaction. Acute reaction. But when dermatophyte transfer from human, from one person to another person, the reaction is chronic, is low. The reaction is low. And some dermatophytes are exist in soil, yes, in soil and plant and instrument that contaminated with soil. These are geophilic dermatophyte. Therefore, we have three sources for this infection: human source, animal, and soil or geophilic dermatophyte. Based on the place, based on the location of infection, we have 7 types of this infection. We have 7 types. Tina capitis, Tina corporis, Tina pedis, Tina manum, Tina croris, Tina angium, and Tina barbi. Somebody tell me what is Tina capitis? I like another person, another student, except him. Only one student studied the lecture that I sent you about 10 days or 2 weeks ago. Okay, what is Tina capitis? Yes, yes. When the infection are in head, the name is Tina capitis. When you have dermatophytosis in head, the type of infection is Tina capitis. Tina corporis, any part of body without head, in trunk, in shoulder, in arm, in hand, in thigh, leg, it is Tina corporis. Tina pedis, yes, in pedal area of foot, of feet, of leg. When you press the pedal, this area, this anatomic site, if you find infection, is Tina hedis. Tina manum, yes, in hand, in palm, in dorsum of hand, in finger, a type of tina corporis. Tina cororis, what looks? Yes, yes. In the skin around genital area. Genital area, when the skin of genital area affected by these fungi, the name is Tina cororis. Tina angium, the nail that uh, we have one term. I will explain it next. We have one term, onychomycosis. Onychomycosis. Do you know what means onychomycosis? Onychomycosis mean itch, any infection, any fungal infection in nail. Onychomycosis, any fungal infection in nail. But when the agent is dermatophyte, is tina angium. Okay, what is different between tina angium, onychomycosis? I explain you. Tina angium is dermatophyte, onychomycosis, but the other fungi, all of fungi, not only dermatophyte, but also the other fungi. We have some additional fungi that affect the nail, candida, aspergillus, some opportunistic mold fungi that infect the nail. When the etiologic, the species, the genus of fungi is not detected, you can use onychomycosis. But when you find dermatophyte that affect the nail tissue, it is tina angium. Tina Barbie, face and neck. When dermatophyte involve skin of face, it is Tina Barbie. Okay, why we classify this infection to five to seven type? Why? No, treatment no. For I cannot hear. Your voice is weak. Yes, yes, yes. One of different between the type of this infection is the type of fungi, the species of fungi, and no, we base the location. We have this type. Why? Why we divide to these seven type of infection? First, the type and species of fungi, species of dermatophyte. Another, no mechanism. No, it is not. It is not good reason. Another reason for this classification is clinical sign. Clinical sign is similar tina angium with tina capitis? No. In tinea capitis, you see missing the hair, but in nail you haven't any hair. You break down, you see break down the nail. Therefore, the classification is based on two factors: clinical sign and type of dermatophyte. We have three genus: microsporum, epidermophyton, and trichophyton. Okay, we must explain these seven clinical type of dermatophyte. First, tinea capitis, the dermatophytosis of scalp. The skin of hair is scalp. Scalp. When the scalp infected by dermatophyte, the infection is tinea capitis. We have three type of tinea capitis. Three type. Not only in clinical but also in laboratory diagnosis. We have three types of tinea capitis. Ectoteryx, endoteryx, and favus. These are three shapes of dermatophytosis in scalp or tinea capitis. Ectoteryx, endoteryx, favus. What is different? What is outside the hair? No, no, no. Yes, your answer is correct. Which element in outside of the hair? A spore or teleconidae. When you see the spore of dermatophyte out of the hair around the stem of hair is ectoteryx, and endoteryx inside the hair. When you see the cluster of a spore or fungi inside the hair, it is endoteryx. And favus, this description is clinical sign. I I want the shape of fungal element in hair. Ectoteryx cluster of spore outside the hair. Endoteryx cluster of spore inside hair. And in favus, no. Based on the shape of fungi, based on the shape of dermatophyte, the shape of structure of dermatophyte. In ecto, we have C spore around the shaft of hair. In endoteryx, you see a spore inside the shaft of hair, but in favus, you see mycelium form of fungi inside the hair. Okay. Uh, in this picture, outside the shaft of hair, when you see a spore of dermatophyte in outer layer of hair, it is ectoteryx. When you see the cluster of spore inside the hair, it is endoteryx. And when you see hive, you can see the hive in distance. You can see this brown filamentous. When you see hive or mycelium inside the hair, it is phagous. You find this uh, structure in microscopic examination. Okay, come back to definition. One different was the structure of fungi around inside the hair. Another question, is there different between clinical sign in this shape, this tree shape? There are some clinical manifest that you find only in ecto, that you find only in endo, and or in favus. They are different in clinical sign. But all of them, all of them show common sign that is missing the hair, alopecia. Do you know alopecia what mean? Alopecia means lost the hair, missing the hair. When the patient miss the hair, the remaining skin show alopecia, alopsy, or alopecia. All of them, ecto, endo, favus, have one one common clinical sign, alopecia, alopsy, or missing or losing the hair. It is common in tree shape. In ectoterics, sometimes you have gray patch, because you have the cluster of spore around the hair. This gray patch show when the fungi grows around the hair, the color of hair change from yellow or black to gray. Therefore, in spread of infection, you have a patch that color is gray. Therefore, in ectoterics, you have gray patch. In endoterics, you have in clinical sign losing the hair, missing the hair, alopecia with some small dot. That name is black dot. Black dot. In observation, with eye observation, you find the black dot. And in favus, you have many clinical signs from scaling, from erythema, from uh, abscess, from crusting, and inflammation of skin. Many clinical signs you may find in favus type of dermatophytosis. Okay, another question. Why? Why the Tina capitis produce ecto, endo, or favus? Why? Why we have three type of infection? Mm, approximate. Repeat, please. No. based on the source of dermatophyte. Based on source of dermatophyte. Human dermatophyte, anthropophilic dermatophyte, lead to ecto, endo, favus. But zoophilic and geophilic dermatophyte produce only ectoterics based on the species of dermatophyte, based on the source of dermatophyte. Okay. In epidemiological factor, we must say dermatophyte in scalp or tena capitis involve children. Children age before produce sexual hormone. The children that go to school, when you have when you have an adult person, the start and beginning the infection, there isn't. The infection the infection in children. It is an infection, especially that you find in children in a school group, a school student group. Is there difference in rate and frequency and number between girl and boy? In rate of infection, is there difference between boy and girl in number? Which one? The girl is more based on the type of tena capitis change. Ectoterics involve both group, girl and boys. Endoterics you can find especially in high number in girl, more than in girl, and favors in both of them. Totally, totally, you find the high number of infection in boys compared to girl. Uh, we see some picture about capitis. You see alopecia in this picture. You can see some pus based on the source of dermatophyte and type of dermatophyte. When you have geophilic or zoophilic dermatophyte, the reaction is acute. You find severe inflammatory reaction, severe uh, erythema. Do you know erythema what mean? Erythema means inflammation that lead to redness. Redness. In this patient, you find pus, inflammation, and missing the hair. When an expert physician or mycologist see this patient, suspect to animal source, suspect to zoophilic source, especially animal source. In this patient, you find the scale mean layer of skin cell, missing the hair and some erythema. In this picture, missing the hair is sharp. It is black dot, a small black dot that is the surface of broken hair. It is surface of broken hair, missing hair. This is we have we have alopecia in this picture with black dot. When we see black dot, we suspect to anthropophilic dermatophyte, and endoterics. Endoterics. In this picture, you see black dot and gray patch in another patient. And favus in these children, favus, multiple reaction, multiple clinical sign you can find in a scalp. Another question, is there difference between treatment of TINA or ectoterics, endoterics, or favus? Is there any difference between treatment of three shape of TINA capitis? Yes, what? Yes, based on the source. Why? Usually, anthropophilic dermatophyte resistant to treatment. They show low reaction, low clinical sign, but lead to chronic reaction, chronic shape of infection, and resistant to treatment. But zoophilic and zoophilic dermatophyte, because the immune system here to control of reaction, treatment is better. But in anthropophilic dermatophyte lead to chronic reaction without any inflammatory reaction, but dermatophyte in zoophilic, dermatophyte from zoophilic lead to acute reaction form of infection. In acute reaction in zoophilic source, in zoophilic source of dermatophyte, may the follicle of hair destroy, and after treatment, after healing, you see a scar. A scar means there isn't any regrowth of hair. Okay? But in chronic form, you have after treatment regrowth. hair. Okay, repeat please. Anthropo. Anacrobo. Cure? Any cure? No, no. In all of them, we have treatment. Okay, we have all of them of tenoid capitis. We must administrate drug. I explain next. Okay, when you have a patient, when you have a children with tenoid capitis, you must suspect to tenoid capitis. For good diagnosis, for correct diagnosis, you must refer the patient, the children with tenoid capitis, to laboratory. It is it needs a laboratory diagnosis. In laboratory, we must prepare the sample. What is sample? In laboratory, we must prepare the sample. What is the sample? The hair, the scale. You must prepare the hair, the scale, and use KOH solution for high resolution of fungi in hair and examine with microscopic examination. In microscopic examination, after preparation of hair, of scale, you must attention to shape of hair. If you see mycelium inside the hair, the diagnosis is favus. If you if you see cluster of spore inside the hair, the diagnosis is endothelics. And if you find cluster of spore outside around the shaft of hair, the diagnosis is ectothelics, and report the physician and decide for treatment. Treatment with antifungal drug. At the end of dermatophyte, I will tell you, with topical treatment and systemic treatment. What is topical treatment? Locally, locally. When you use cream or ointment or solution locally, it is topical treatment. When you admin orally, it is systemic treatment. The treatment of tenoid capitis need both way, locally, topical, and systemic. In treatment of tenoid capitis in form of endothelics and favus, you need at least 3 months administration of drug. And about geophilic and zoophilic source, you need about one month to more, maybe. Okay, uh, how we we can understand the source of dermatophyte. We see the patient and suspect with clinical sign. It is one way, but it is not complete. The main way of detection, the source the etiology of agent, the type and species of dermatophyte is culture of a specimen and isolate the dermatophyte from media. And you need for find the source of infection to culture report from laboratory. Which type, which species of dermatophyte you find in media in laboratory. It is complete, it completes the answer of the diagnosis. Therefore, for a good diagnosis, a correct diagnosis, a complete diagnosis of dermatophytosis, we need direct microscopic examination and culture method with isolation the dermatophyte. It is complete answer. It is complete report.
So the culture method, how many days to get the answer?
John,
Culture method.
the culture method?
How many days to get
Oh, oh yes, yes. For culture in isolate dermatophyte, we need media that name is SCC. In continue, I explain it. SCC saburo with chloramphenicol with cycloheximide. It is a media that you must culture and keep it in 27, 25 centigrade degree in laboratory degree for at least 1 month, 1 month, or 4 week, or 4 week. And after that, you can out the media if any colony grows. Black dot, your voice is weak. Black dot, black dot is any no, only in scalp.
Yeah, I know. So it formed because of the ingrown hair. If you give it a black shape and as a black dot or whatever.
I cannot understand what. After killer, after the finish. Tina corporis, another shape of dermatophytosis. Tina corporis means dermatophytosis of a skin body, and it leads to a ringworm shape or ring form or annular lesion. Annular means ring. Or circinata. Circinata, synonym of ring form. Uh, there are many species of trichophyton, microsporum, and epidermophyton that lead to Tina corporis. I think before explain the skin disease, we introduce some species of dermatophyte. This page, this slide shows some important dermatophyte. At first, we have Microsporum canis. Microsporum canis, that you can find it in which animal? It is zoophilic dermatophyte. You can find Microsporum canis from skin of canine, cat and dog, cat and dog. Cat and dog have these fungi in hair and contact direct or indirectly to contaminated material lead to contamination, lead to infection. Microsporum canis is one of important dermatophyte now. Trichophyton rubrum, another dermatophyte. Trichophyton rubrum. It is the most common agent of dermatophyte. Trichophyton rubrum. It shows worldwide distribution. You can find it in each country. Trichophyton rubrum. After that, Trichophyton mentagrophytis. Trichophyton mentagrophytis. It is another common dermatophyte. First, Trichophyton rubrum. Second, Trichophyton mentagrophytis. Trichophyton rubrum is anthropophilic. It has human source. But T. menta, Trichophyton mentagrophytis, have two sources, animal source, human source. These change to one together. Microsporum ferruginum. You can find this dermatophyte in yellow race uh, in Japan, in China, in Malaysia, in Korea. You can find in yellow race. You cannot find in your country, in Asia, in America. There was this. Microsporum gypsum. Microsporum gypsum. It is a geophilic dermatophyte. You can find in soil and lead to acute type of ectoterics. Acute type of ectoteric. This may be a question. Which of dermatophyte lead to acute ectoterics? For example, Microsporum gypsum. In Epidermophyton genus, we have two species. Epidermophyton genus, we have two species. One species is important, is pathogen. Epidermophyton felucosum. It has a human source. Epidermophyton felucosum, that you can find it in Tina acroris. Another question, another example question for your exam. Which dermatophyte lead to Tina corporis? Usually, Epidermophyton felucosum. Trichophyton verrucosum. Trichophyton verrucosum. It is important. Why? Because you can find it cow and sheep skin and some person that work with this animal can affect it and show tenocapitis in children, tenobarbi in adult person. Trichophyton schwenleini, the main dermatophyte for Tinea favusa, favus type of dermatophyte. And Trichophyton violaceo, Trichophyton tonsorans. They are anthropophilic source, human source, and lead to endoterics form of tenocapitis. If we find the source, of dermatophyte, or better, is there important we detect the source of dermatophyte? What is important that we find the source of infection, the source of dermatophyte? What is? Why we must find the source of dermatophyte?
How it's long, the period of time in the person.
One reason.
Like, zeophilic and geophilic, it's a
Yes.
shorter period of time.
Yes. It is not. It is not enough. It's good, but it's not enough. Why we must detect and find the source of dermatophyte to prevention. It is the good answer. We must, when we find the source of infection, we decide for prevention. We cut the transfer because this infection transfer from one person to another person may in a class, not in this class, in primary school, you have an outbreak, an epidemic of the infection. Uh, I think you have a rest. You have a rest about a quarter, and I have a relax.